Hi there. Today I'm going to talk about getting an epidural during transition. Sometimes, no matter what your original plans are, labor becomes too intense and you decide to get an epidural. Often the peak of intensity is during transition is when your cervix is more than 7 centimeters dilated. The contractions are coming every 2 to 3 minutes and lasting between 60 to 90 seconds long, which only gives you a break of 30 seconds up to 2 minutes tops. While this is a difficult time to have an epidural placed, reducing your pain to practically nothing will likely be worth it. Once you give the word, the anesthesiologist will be notified, but it's possible that there will be a wait if they are with another patient or in the operating room with a cesarean delivery. In the meantime, the nurse will start an IV if one has not already been done and have you empty your bladder. Once anesthesia arrives, they will talk about the risks associated with the epidural, ask you a seemingly endless list of health questions, and have you sign a consent form saying that you understand. It's a good idea to know these risks in advance because let me tell you, you're not going to care one iota what that sheet says when you're in transition. You'll likely be like, yeah, whatever, just hurry up and do it. The anesthesiologist will then have you sit on the edge of the bed with your back arched up like a cat towards them. Often you curl around a pillow and the nurse or your support person sits in front of you to help stabilize you. The doctor will inspect your back to decide placement. They'll stick a drape on with a hole in the middle. Then they'll wash your back with iodine. They'll inject a little bit of local anesthetic to numb the area. Since this is all done at the peak of your labor, it can take longer than usual to work around all of the contractions because they do stop working when the contraction comes. As soon as a contraction has ended, they'll place the epidural needle in, asking you to stay absolutely still. At this point, if a contraction comes, you have to just grin and bear it and stay absolutely still. It is likely that you will get a combined spinal epidural, which will kick in faster. A tiny catheter will be placed in through the needle, and then the needle is removed. This catheter will be taped in place with plenty of special bandages, and they usually use this spray adhesive as well. The catheter is then hooked up to a pump, which will continuously, wow, that's a mouthful, continuously, there we go, administer medication until turned off at the time of birth. You will feel less and less with each contraction. Often the anesthesiologist becomes the favorite person in the room, and you will feel complete relief by the time they complete all of their charting and recording and leave. And now you can quickly catch a few winks before it's time to push.